Disorders of Consciousness and EEG. The introduction. Many patients survive traumatic accidents and diseases causing brain damage. However, they may not be in fully conscious states. Their brains are then in disorders of consciousness, or DOC. Disorders of consciousness include a state of wakeful unawareness specified as a vegetative state, which is VS or UWS. Locked-in syndrome, LIS, where a patient has lost all motor functions but is fully conscious. A minimally conscious state, or MCS, where a patient has some transient signs of consciousness and may fully recover. Unfortunately, the misdiagnosis of these states are frequent. And as such, researchers of this experiment sought to remedy the frequency of misdiagnoses with EEG and the circadian rhythms found within it. Sleep and disorders of consciousness. In sleep, one is in a state of transient but reversible unconsciousness. Interactions between sleep and consciousness in brain-injured patients are not well known, but it has been determined that some sleep patterns may correlate with positive diagnosis and prognoses of disorders of consciousness. The research experiment. When analyzing the EEG patterns of the various states of disorders of consciousness, researchers looked at the sleep patterns of the occurrence of structures such as sleep spindles, slow waves, and their variability across time. The researchers discovered that there are significant differences in the occurrence of sleep waves characteristics between conscious patients with MCS and LIS, and unconscious patients, so patients with VS and UWS. They also discovered an etiology effect where traumatic patients were more likely to show preserved EEG sleep-like activities than patients without severe traumas. So in conclusion, EEG analysis can help to more accurately diagnose and develop prognoses for disorders of consciousness. Thank you.